Suicide knows no socioeconomic class, no race, no religion. It's a difficult subject to talk about. We visit with Julie Moore in today's Health Minute. Suicide is a difficult conversation to have, but it's an important one for our community to have. To help us with this, we've brought in Julie Moore from Avera St. Mary's Foundation, and also with us is Sergeant Tony Maunu from the South Dakota Highway Patrol. Welcome both. Julie, tell me a little bit about September 9th. We have a day coming up, the Suicide Prevention Walk.
Yes, on September 9th at 8:30 registration will start. The walk will actually begin at 9. This year the name of the walk is the Walk of Hope, coming together to prevent suicide. It really takes a whole community to prevent suicide. We have a couple of different goals for the walk. One is to promote wellness, to give the survivors a chance to remember their loved ones. And the last one is to bring more awareness around suicide and mental health.
I know that this is a topic that we visit annually, and we need to. The fact is that this is a continuing topic in our community. So this is not the first suicide prevention walk and awareness. It's something that many people draw strength from each year.
It is. It provides a lot of hope and healing for the people who have lost loved ones, or even for the people who are struggling themselves. They could come down to the Capitol Lake Visitor Center and see that there are other ones going through the same thing that they're going through.
Now, I want to talk to you a little bit about training, because that's an important part of what you do, and we'll talk about that here in a minute. But first, let's draw Sergeant Maunu into the conversation here. I know you as South Dakota Highway Patrol, but tell me a little bit about how you came to be involved in this topic.
Well, actually, my next door neighbor, Rick Doctor, has been a longtime member of the suicide prevention team, and he came and asked me if I would be willing to talk. And I thought, boy, I'd be honored to. As you can imagine, having worked 20 years in law enforcement, suicide is something that I've been exposed to. So I'm very honored. We're looking for a lot of support from the community for this walk. I'm going to be talking about suicide prevention, education from a law enforcement officer's point of view, a little bit of different perspective through the lens of a public servant.
You know, and I'd like to know a little bit more about that, knowing your past and your background a little bit. It does impact first responders and people like that in different ways. So when we talk about this being a community issue, it really affects everybody from care staff, pastoral staff, hospital staff, but also law enforcement, firefighters. There's no area of our community that this does not involve or concern.
Yeah, that's absolutely right. In addition to that, it's not a matter of law enforcement being the ones to fix the problem. It's not the matter of the counselors being the one to fix the problems. Suicide ends up affecting law enforcement officers, the occupation, the profession has a high rate in and of itself. So it's something that we as a profession have to deal with on both sides of the coin.
We're the safety switch. We're the last people called in there. Julie, long before we want to see law enforcement involved, we can be doing prevention. And a lot of that comes down to awareness. And you train people in specific programs required by state law now here in South Dakota to be on the lookout for suicidal ideation and awareness. So tell me a little bit about that training and what you offer.
I offer 2 different trainings through the foundation. The first one is QPR, and that one takes about an hour and a half, and that's really learning those warning signs. Pain isn't always obvious, so sometimes we have to learn those warning signs of why someone might be thinking about suicide, and then how to ask that important question. Are you having those thoughts of suicide? And once you get to that point, where are you going to refer them to? How are you going to get them the help that they need? And that's QPR, and we're going to be offering that one once a month here in Pure. The other one is the assist training, and that's a 2-day intervention training, and that one is just a lot more in depth, and it really gets into the conversation that you're having with someone who's having those thoughts of suicide.
I know a lot of people that are watching this program right now, they contact us after the program airs and say, well, what should I be on the lookout for as a parent, as a family member, as somebody who's concerned about this? What can I do today, or what should I be watching for today? What advice would you give those?
The main thing to be watching out for is a change in their behavior. If they're normally a very happy-go-lucky person and all of a sudden they're really sad, we need to find out what's going on. If they're really active in school and all of a sudden they're skipping classes, what's going on? But watching for that change in behavior. If they're normally not drinking much and all of a sudden they're drinking a lot, something's going on with them. It doesn't necessarily mean that they're thinking about suicide, but that's usually a pretty good clue that something going on with them.
And if you have those concerns, what's the next step? Where does a person turn? What help is available? Because help is available.
There is help here in Pierre. The first thing you could do is you could call the 1-800 number, 1-800-273-855, or text START to 741. Those are two great resources. My friend is struggling, how do I help them? Or even if you're struggling yourself, you could contact those numbers. But safety is important. If they are in intimate danger, in crisis, and they want to harm themselves and they have the means, we need to be calling 911 immediately.
Sergeant, this might be the right time to bring this up. A lot of things have changed, say, in the last 20 years concerning law enforcement and how public safety responds to suicide and to similar situations and circumstances. The real goal here is not so much arrest and enforcement, it's become prevention and treatment. Your thoughts on that?
That's absolutely right. As a matter of fact, that's part of training that we do every 2 years, looking at de-escalating, looking at dealing with people that have emotional issues that they're going through, and really makes our officers, our troopers, aware that there are people out there hurting, whether they want to hurt themselves, whether they want to be hurt by law enforcement in the suicide by a cop, something that we really watch close. So, and we're getting a lot of extra training on it now.
We appreciate all that you and your troopers do, and appreciate that safety for our community as well. Julie, again, date and time, and I'll also ask, who should attend this?
The Walk of Hope, Coming Together to Prevent Suicide, is on September 9th. We start registration at 8:30. We need the community there, from law enforcement, from pastors, to just your everyday citizens, medical, people who have lost loved ones, people who just want to come down and really support the cause and bring more awareness to suicide and mental health.
All the best. Thank you again.
Thank you.
We can all do something about suicide. It's not a joking matter, so don't use the topic as a punchline. Now you're part of the solution, and you're helping make a difference.